You're listening to News Hour from the BBC. I'm Razia Iqbal. There is little that is not distressing about this pandemic, and we can see quite clearly now that in most countries there are two front lines, if you like. Hospitals, of course, and residential care homes, where some of the most vulnerable in our communities live. It's care homes we're going to focus on now, places where people live in close contact with one another and their carers, and where we have seen considerable fatalities. I've been speaking to Eric Fuster, who has taken the lead in crisis health situations for cholera and Ebola in Haiti and Sierra Leone, respectively. What he's learned from those front lines has allowed him to come up with ideas which he says should be implemented urgently in order to save lives in care homes.
If we don't stop the transmission of COVID in care homes, well, we know from other countries about a third of the residents die off. So it's really, really serious. And I hope it's not too late already, but it is like an emergency response. It's like us doing the Ebola thing. You know, there's no time to dither.
So tell us what it is that you've learned that can be applied to the current pandemic and specifically to do with care homes.
It's a similar principles in many of these things, and especially with the Ebola, you have a lower risk area and a mid risk area and a high risk area. So you try to sort of map out your area, and between each of those areas you have strict procedures about what you're going to put on in terms of PPE or what you're going to take off, especially about hand hygiene and so on. So I believe that those sort of layouts came from what people learned in the SARS outbreak back in 2003, which was a virus as well. And we think that this is very applicable for this case as well. Similar scenarios, similar ways of stopping transmission.
And just so when you talk about these different zones that have to be set up, is it relatively easy to do in each individual specific care home? Is it easy to present it as, here are the guidelines, adapt it to the physical space that each care home is having to deal with?
Well, this is the document we came up with to try to be as sort of practical and pragmatic and succinct as possible. But I think it's a very complicated environment because, and this is really the challenge in the care home, you have this situation which is really not ideal, where you've got asymptomatic and symptomatic together, all in the same building, and staff coming and going. And it's really, very, very complex. So it's not like a healthcare facility where you have total control and you can really just physically lay it out how you want. In a care home, you're stuck with what you have. Some residents in some rooms are ill and others are not. And every layout, every physical building is going to be different. Small, large, sheltered housing, nursing care homes, all kinds of variations. So the key for us is to get the concepts understood out there by the care home managers, to sort of try to understand the principles about what they need to do, which is probably a lot more than what they're doing now.
And you don't think, at the moment, the way in which care homes are working in many countries is people are just dealing with the incidence of Covid-19 as and when they find it. This would require a complete rehaul of how they've been operating so far. Do you think that it's possible for people to completely rethink how they run what must be hundreds of thousands of care homes all over the world?
It seems like an impossible challenge, but when we've got an impossible situation, we must do what we can and try. I think it's going to be a very big challenge for sure. But yes, this idea that you decide the type of PPE and the type of care you take to stop infection based only on symptoms, that is not working, because we've got asymptomatic transmission happening. And we know that now. We know. So we've got to have another strategy that goes beyond just monitoring symptoms. Just doing your infection control and your care and your PPE just based on symptoms is not stopping transmission in care homes.
That was Eric Fuster. Let's look at the lack of adequate personal protection equipment for doctors, nurses and ancillary staff here in the UK.